Hi everyone, I am Dr. J. Sunil Kumar, SK Clinic and Scans, Poovar, Thiruvananthapuram, Kerala. Today, my topic is long COVID or post COVID. In February 2022, one lady of 36 years came to see me in my clinic with complaints of chest pain, palpitation, and fatigue. She attended different doctors and clinics and did all the tests advised by them, but no relief. She is still having the symptoms. She also gave the history that she had COVID 6 months back. This clinical scenario can be considered as long COVID, and today I'll be discussing in detail based on research articles. Today, in my presentation, I shall include the definition of long COVID, its prevalence, symptoms, basic pathology, prevention and treatment, and my personal experience in a drug trial conducted by me in February 2022 and the treatment outcome of the lady about whom I mentioned in my introduction. This video will be in two parts for your convenience. In the first part, definition, symptoms, prevalence, and in the second part, the remaining portion like basic pathology, prevention, treatment, and my personal experience. The article you are seeing now is published by CDC, Center for Disease Control and Prevention, updated on May 2022 regarding long COVID or post COVID conditions. It clearly mentions the definition, symptoms, and prevalence of long COVID. Now, what is long COVID? Some people who have been infected with the virus that causes COVID 19 can experience long term effect from their infection, known as long COVID. People call long COVID symptoms by many names: post COVID syndrome, long COVID, post acute COVID 19, post acute sequelae of SARS CoV 2, long term effect of COVID, and chronic COVID. That is, for example, you had a COVID in 2020 and still you are experiencing some symptoms. That is long COVID. Some people may have symptoms for only 2 weeks, for some others, few months or years. All of them may not be having same symptoms. Most of the people get COVID-19 get better within a few days, and after few days they have symptoms on and off. Most people with the post-COVID symptoms experience symptoms days or months after COVID-19 infection. But some people with the post-COVID condition did not notice when they first had an infection. There is no specific test to diagnose post-COVID condition, and people may have wide variety of symptoms. People with the post-COVID conditions can have a wide range of symptoms that can last for more than 4 weeks or even months after infection. Sometimes the symptoms can even go away or come back again. Post-COVID condition may not affect everyone the same way. People with the post-COVID condition may experience health problems from different types and a combination of symptoms happening over different length of time. Most patients' symptoms slowly improve with time. However, for some people, post-COVID condition may last months and potentially years after COVID-19 illness and may sometimes result in disability. People who experience post-COVID conditions most commonly report General symptoms like tiredness, fatigue, and interference with the daily life. Symptoms that get worse and physical or mental effort, fever, respiratory and heart symptoms like difficulty breathing or shortness of breath, cough, chest pain, fast beating or pounding heart known as heart palpitation, neurological symptoms like difficulty thinking or concentrating, sometimes referred to as brain fog, headache, sleep problem, dizziness when you stand up, lightheadedness, pins and needles feeling, change in smell or taste, depression or anxiety, and the digestive symptoms are diarrhea, stomach pain, and other symptoms like joint pain, muscle pain, rash, changes in menstrual cycle, hair fall, etc. This article, Prevalence of Ongoing Symptoms Following Coronavirus Infection in the UK. It was released on 6th May 2022. An estimated 1.7 million people in the UK, that is 2.7 of the population, were experiencing self-reported long COVID symptoms, that is, symptoms persisting for more than 4 weeks after the first suspected virus infection. Long COVID symptoms adversely affected the day-to-day activities of 1.1 million people, that is 67% of those with self-reported COVID-19. Fatigue continued to be the most common symptom reported as part of individuals' experience of long COVID, that is 51% of those with self-reported long COVID, followed by shortness of breath 34%, loss of smell 28%, and muscle ache 24%. As a proportion of the UK population, prevalence of self-reported long COVID was greatest in people aged 35 to 49 years. Females, people living in more deprived areas, those working in social care, teaching and education or healthcare, and those with another activity limiting health conditions or disability are most affected. The first part of the series ends here. The second part, basic pathology, prevention and treatment, and I shall also share my personal experience on a drug trial in which my clinic also was participated. I shall also share the clinical outcome of the patient mentioned in my introduction. It will be encouraging if you will like, share, and subscribe. Thank you.